Hi, my name is Darcy, and I will be doing a presentation on endometriosis. So what is endometriosis? Endometriosis is a common condition where functioning endometrial tissue is present outside the uterus. It can be found anywhere in the pelvis, including the fallopian tubes, the bladder, the ovaries, the round ligaments, the broad ligaments, all of the above. It can also be found in the abdominal cavity, which is very rare, but not uncommon. The endometrial tissue will cyclically bleed and proliferate. It can appear to be a pelvic inflammatory disease or a chronic ectopic pregnancy. There are two forms of it. One is a diffuse, and what that is endometrial plantings within the peritoneum. The other one is localized, which is also known as an endometrioma, and those are discrete masses found at multiple sites. There are two theories as to why endometriosis is diagnosed. The first one is chronic reflux, and chronic reflux is basically just the reflux of menstrual fluid through the tubes and into the pelvis. The second is evolution of endometrial activity, which is where susceptible cells that retain embryonic capacity differentiate in response to chronic irritation or hormonal stimulation. So the picture on this slide, the causes of endometriosis, we have hormonal disruptions, which is a very big reason. And then we have reduced immunity, heredity, bad ecology, liver dysfunction, abortions, and iron deficiency. Some demographics related to endometriosis are as follows. Endometriosis affects roughly 10% of reproductive age women and girls globally. There is no cure for it. There are medications that are used for controlling the symptoms, so the pain that comes with endometriosis and so on. A statistic about endometriosis is the Asian race is 50% more likely to be diagnosed compared to other races. Endometriosis cases have occurred in 204 different countries and regions from 1990 to 2019. Some other factors play a role in endometriosis. And I only put down three of these. Three of the factors are early age during menarche, which is starting your period at an early age, a shorter menstrual length, and that's what that is when your period is shorter than normal, it doesn't flow for long. And then another one is based on how tall you are. The taller you are, the more likely you are to get it. Some clinical symptoms for endometriosis. Endometriosis may be asymptomatic, which is usually the diffuse form. Other than that, you have pain in the lower pelvis, usually during a period, during or after sex, or when using the bathroom. It consists with chronic pelvic pain, heavy bleeding during or between periods. You may have trouble getting pregnant. It also comes with side effects of bloating or nausea, fatigue, and depression or anxiety. So the sonographic appearance, there's a little bit of different ways that it can be seen on ultrasound. It may appear as bilateral or unilateral ovarian cysts with patterns ranging from anechoic to solid. Another thing is obscured organ borders and multiple irregular cystic masses. Well-defined unilocular or multilocular cystic masses with homogeneous low-level internal echoes. It can also have small linear hyperechoic foci, which would be present in the wall of the cysts. So there are many different ways that endometriosis can appear on sonography, on ultrasound, and usually you can't really diagnose it, but sometimes you can. Treatment options for endometriosis. You have IUDs, vaginal rings, injections, nonsteroidal anti-inflammatory drugs, painkillers, hormonal medicines, medications, and exploratory surgery. Exploratory surgery would be one of the very last options that you'd want to choose, just because they do look around on the inside of your body. So usually you go with painkillers and medications and hormonal replacement. Prognosis. So there are 4 different stages of endometriosis. The 4th stage is really rough and you don't really want to get to that point. So The doctors try to control it and keep it to whatever stage it is at when you go in to see them. It is a chronic condition and it cannot be cured. There's also a high rate of reoccurrence. All right, and this is my reference slide. So if there are any questions, please feel free to reach out. If you want any more information, the book that I cited is a very good book to go look into. Thanks for watching my presentation. Have a good day.